for this MQ fellowship, I will be looking at bullying victimization and cyberbullying victimization. And we know that it's a huge problem because up to a third of children are affected by this issue. And my fellowship will focus precisely on trying to identify the mental health consequences of having been bullied in childhood. And the idea is that I will use a large set of what we call longitudinal studies. So there are studies that follow children from childhood to adolescent throughout adulthood in order to try to identify the consequences again of having been bullied on the mental health of these children. And a side question being how long can we see this impact of being bullied in childhood on mental health outcomes like anxiety, depression, or even very serious outcomes like self-harm, etc. As a researcher, the idea is that you will find something new and suddenly you will solve the problems of the world. For my research in particular, what I hope to achieve is, again, provide this kind of clearer picture of the consequences of bullying victimization so that both clinicians and people who design interventions have better insight into how to design interventions that really help these vulnerable children. I think that it's really important for mental health science to be funded for two quite simple reasons. The first reason is that it's a really important issue that affects so many people. And the second question is that there is nowhere nearly enough money, enough investment in mental health science research. And so there is no miracle. You know, if you want to to have any impact, you need to have investment. You need to have a lot of researchers tackling these complex ideas. I can see two of them. The first of them is clearly the investment, the lack of investment. And the second of them is kind of the complexity of it. So if I take the example of the HIV epidemics, for instance, it started in the 80s, and at the time, being diagnosed with HIV was a kind of short-term death sentence, basically. And now, a bit more than 30 years after, it's just a chronic disease in a way. And this is it's really a massive achievement. But it took so much money, so much investment in order to arrive to that point, and so many people, like thousands of researchers investigating this precise area. And then HIV is due to a virus that is a very well single identified agent that causes the disease. For mental health, it's much more complicated. First, it's kind of heterogeneous. There are so many conditions. There are so many levels of explanation. So you have like the genetic level, you have the brain level, you have the psychological level, you have the sociological level. And all these levels, they interact in a complex way in order to generate mental health issues. And so again, if you want to achieve, to have any impact, you will need, because of the complexity, to invest massively in this area of research.